Hi, I'm Dr. Anthony Cave, a Stanford and Harvard-trained, board-certified anesthesiologist and integrative medicine specialist. And we're going to talk about why most women don't know what's most likely to kill them. It kills more than all cancers combined, and it involves Estee Lauder, Self Magazine, and pink ribbons. Let's talk about why we don't hear more about the most important threat to women's health. Even though it kills 1 in 3 women and kills more than all cancers combined, including breast cancer, we don't talk about it as much as we should, and that's heart disease. Things like heart attacks, strokes, heart failure, and more. Why don't we talk about heart disease in women? For the longest time, us doctors didn't realize that heart attacks happen in women just as much as they happen in men. And even after we realized that heart attacks are an equal opportunity disease, it took us a long time to recognize that the symptoms of heart attacks in women can be different than the symptoms of heart attacks in men. Men often have the classic left-sided chest pain, maybe radiating to the jaw. Women can have that as well, and it's still the most common symptom, but they can also have lots of other symptoms that we call atypical. Things like fatigue, or shortness of breath, or dizziness, or abdominal pain, or even indigestion. And you can see that there's a lot of overlap between these atypical heart attack symptoms and things like anxiety attacks, which are also more common in women. And we need to diagnose quickly because minutes matter to save heart muscle in heart attacks and save neurons in the brain in strokes. Unfortunately, way too many women and men aren't familiar with these signs and symptoms of heart attacks, especially in women. And if we delay our diagnosis, we risk more deaths in women. There's also huge overlap between pregnancy and future heart disease. When I'm placing epidurals in pregnant women in labor, like this epidural here, we come across women who've had complications in pregnancy or who have newborns with complications. And these can all predict future heart disease in mom. But my patients don't hear enough about this, partly because there are more attractive and lucrative advertising campaigns just around the corner. So heart disease kills more women than anything else, including all cancers combined, and its signs and symptoms are pretty different than those in men, making it harder to diagnose. Despite this, we're inundated by pink marketing everywhere. Pink cosmetics and makeup, pink shoes, pink clothing. And despite all this, it's still preventable in the majority of women. So why don't we talk more about it? Partly because there's more money to be made in other advertising campaigns. Breast cancer is terrible, no question about it. Horrible for patients and their families. But despite this, many women with breast cancer and survivors feel that their suffering is being taken advantage of by big corporations in targeted advertising of pink paraphernalia to women across the world. You can't walk outside and not be bombarded by pink products everywhere. Everything from cosmetics to clothing, like giving the boot to breast cancer, cosmetics that may include parabens that may increase the risk of breast cancer, buckets of fried chicken, which also can increase the risk of breast cancer, or even the NFL increasing pink sponsorship to increase women's viewership. This is a far cry from the original intention of the breast cancer ribbon. It wasn't even pink to start with. Charlotte Haley was a fierce breast cancer advocate, and she developed a peach-colored ribbon. It was so successful in the early 1990s that Estee Lauder and Self Magazine approached her wanting to commercialize her ribbon. Charlotte felt this was not in line with her original intention, so the companies went back to their legal counsel and realized that if they just changed the color of their ribbon, they could use the breast cancer ribbon without Charlotte's permission. This isn't Charlotte's original vision because the breast cancer ribbon has now become a symbol of femininity. In particular, women being confused about their treatment options after being diagnosed with breast cancer, almost like a damsel in distress-like symbol. Putting aside that breast cancer can also kill men, this is a problematic symbol. There's also incredible controversy around where pink product sales revenue goes because the financials are not transparent. In fact, the vast majority of funding for breast cancer research comes from the federal government. And this is where the term pinkwashing comes from because of the controversies and inconsistencies of this message to help support breast cancer research and prevention. So while raising awareness for breast cancer is incredibly important, it has been neglecting the #1 cause of death in women, which is heart disease. That's where the red dress campaign started, almost in competition to the pink ribbon. It's also kind of a fashion symbol that can be targeted to women shoppers. There's a lot of overlap in emphasizing prevention. It's not just screening for mammograms, but also maintaining a healthy body weight, potentially an anti-inflammatory diet, and limiting alcohol consumption, these are both shared risk factors for both breast cancer and heart disease. And this message can be brought across without women feeling that their suffering is being taken advantage of for corporate profit. So let's take advantage of the undeniably good intentions behind these two awareness campaigns to raise awareness and save women's lives, and not use these as targeted marketing campaigns to target women shoppers to buy more products and contribute to them feeling disempowered against things like breast cancer or heart disease.